Now, second blind spot is often we think that we can parachute AI into our hospitals and immediately all results will start flowing. Unfortunately, that's not true. You need a lot of different support systems in place for AI to do its magic. For example, AI may help you to improve clinical decision support systems, but they need to exist in the hospital. And people should be using them to some extent today. For people to use clinical decision support systems, they must believe in evidence-based medicine and that they have some kind of a standardized medical approach to treating patients, be it any specialty, right? For us to use AI, someone mentioned this earlier, I need to have data, and this is not just data from global data sets, my own data, my own patients, and not just data, I need to be able to see if I did X, Y happened to the patient. If I did X dash, Y dash happened to the patient. And Y dash is better than X dash, and which is why I want to do Y and not X. Often we don't have that level of intelligence from our own data. Now, we already saw very sophisticated technologies that are embedding AI in them. They're going to be expensive. And so if I use them, how does it help me to reduce cost, improve revenues? We need very complex, very detailed activity-based costing system to say, if I'm going to save that 35% of time for a patient, where does that time get saved? Which particular human resources time gets saved, and therefore how much overall money am I saving using AI? It's impossible to do this estimation unless I have activity-based costing systems. It's impossible to think along these lines if I don't do process-based management, if I don't have quote-unquote process owners. If my hospital is divided across different departments, the same departments that the patient goes across, but nobody has an overview of that entire journey, nobody owns the patient journey, nobody is accountable for the patient journey, it's going to be very difficult for AI to have any sort of business impact. The third is you don't understand fully where AI sits into the technology continuum. Okay, most of us think that AI will come in and change my decisions or help me make better decisions. That's just one box in the technology continuum, okay? Making better decisions or improving decision making in the existing processes. That's my fourth box. But for you to reach that fourth box, you need to even have an understanding of how many different processes are there today, who is making decisions in those processes. Are those explicit decisions, or are they decisions that are being made by habit, by legacy, so on and so forth? And once I understand how to make my decisions better, the next journey is not the end. The next journey is, can I reconfigure my processes? Do I now realize that certain processes are defunct, they're no longer needed? Or do I use AI to even create new businesses, right? We heard the Honorable Minister talk about proactive versus reactive healthcare. But it's not going to happen overnight, because it also needs to have an overall business model around it for me to provide proactive care to my patients. Today we make money when the patient walks into the hospital. We first need to conceive of a reality where we make money when the patient leaves the hospital. Okay? Or I prevent someone from walking into the hospital and I make money. Those business models have to be thought through. The fourth blind spot is that we often don't think about various internal stakeholders, okay? And clinicians are the number one stakeholder that anyone can think of, and I think that's appropriate. I think more than required, we ask clinicians about ideas on how technology can be used. I think we need to reverse it. We need to ask our clinicians, what are the problems that you face that you want AI or technology to solve for you? I don't think it is the clinician's burden to give you ideas. Clinicians' burden already is that they have a lot of problems that need solving. We need to help them to articulate those problems much more clearly. But then that's just one stakeholder. Think about the frontline worker who is collecting data for you, who is going to do things differently for you because you've got a new AI-enabled machine. What's the benefit for them to do that? Okay, we'll complain that, oh, they don't want to do this, they're not cooperative. But what are their costs and benefits of adopting this new AI technology solution, so on and so forth? And then the technology team itself, do you even have adequate staffing of that technology team? Do they have the right skill set? Are you hiring top of the line technology people, or are you hiring people who cannot find opportunities in the technology market? And what are you expecting them to do? Are you expecting them to create new models? Because creating new models and algorithms is a very high investment proposition. Instead, would you want your technology people to play the role of a bridge between the existing solutions and the care delivery? Can they help you to monetize, to realize the potential of AI rather than develop new algorithms and new models? And the last blind spot is we think that this AI stuff is, that we are missing the boat. We should jump, right? We should jump on the boat, and if we miss the boat, we'll swim and catch the boat, right? I don't think that's this journey. I mean, I've just put out something that Deloitte had done a survey of hospitals across different states in the US, and most people say that they might have finished 4 to 5 years of their journey and they're not even halfway through. So it's a marathon, it's not a sprint. You're not going to finish it in the next quarter or next year. Are you ready for that? If you are one of those who's going to loosen your purse strings, have you thought about a 10-year journey for AI to start making money for you? And now those who do the 10K, 15K, 20K run, I'm not one of those, but you now know how to run that, right? Because you divide it into 1K at a time. And you say, okay, I've completed 1K, give yourself a pat on the back, very good, we've gone this far, let's go. So what are those intermediate milestones? How will you capture small wins that keep your team engaged, encouraged, so on and so forth? And then be ready because, the weather changes. You ran 3K and then it started raining. So what are you going to do now? You got to change your plan, you got to be nimble. So you don't have to have a very monolithic plan for 10 years. You've got to be able to adapt. So those are what I thought were 5 blind spots. I'm sure there are more, but I want to just open this discussion. While AI is exciting and it will change the world, but it will change the world differently for different organizations. If we are simplistically thinking that everyone will turn out to be a winner using AI, it's not true. So we have to think very hard, what is my business and how can AI help me make my business better, make my patients better? Thank you so much for your time. Thank you.